some water on my shirt. So yesterday, the CDC sounded the alarm to gay and bisexual men as the new Monkey Pox is running rampant in their community. While I don't traditionally make this content, we do speak on news and interesting things over here, so I definitely wanted to touch on this subject and make everyone well informed. Also, I don't know about you, but this kind of reminds and parallels me with kind of like HIV, where the CDC is kind of like, hey, anyone can get HIV, but it's likely if you're this sexual orientation. Kind of seems the same with monkeypox, where they're like, hey, anyone can get monkeypox, but somehow they're putting out a report for the bi and, gay men community. So I live in Atlanta, the land of the trap houses, the land of lemon pepper wings. We've got the Braves, and of course, we've got a lot of strip clubs. But if you live here, there's a massive LGBTQ community. So let's get into the facts from the CDC and make sure we're all very informed, no matter what your sexual orientation may be. So first, on Monday, the CDC reported that gay and bi men should take necessary precautions as this is spreading globally in their community, warning people to take precautions if they've been anywhere around anyone who may have had the disease, and also if you have any of the possible symptoms. And yes, I know gay and bi men do not reflect the entire LGBT community. Now, they said that it can be contracted regardless of your sexual orientation, but warns that many of the people affected globally do identify as bi or gay, and it is specifically men. Dr. John Brooks, a CDC official, said, "We want to help people make the best informed decisions to protect their health and the health of their community from monkeypox." Now, monkeypox is not a sexually transmitted disease, which, comes from Yeah, I apologize for that. But it is spread through body fluids and sores. Body fluids? Okay. Now, this disease is similar to a few and includes fever, headache, muscle aches, chills, exhaustion, and swollen lymph nodes. Is it just me? Like, there was the C19, then there was the Delta variant, then there was, the lemon pepper wing variant, then there was the GME to the moon for the chicken tendies variant. Is it just me, or are they always described as the flu? Then you may start to develop body rashes on the face, hands, feet, eyes, mouth, or genitals that turn into raised bumps which then become blisters. Now, according to the CDC, patients are most infectious when they do have this rash. It can spread through respiratory droplets or from the throat. Still, this is only from prolonged face-to-face exposure, so everyone, let's please remember this golden rule. He also wants to emphasize that this is not C19 and isn't from respiratory spread, but intimate contact in the current outbreak setting and population. I don't know about you guys, but I feel like this would have to do less with your sexual orientation and more from what area or what location that you live in. The US has confirmed 1 case of monkeypox in Massachusetts and 4 cases of orthopox in New York City, Florida, and Utah, according to McQuiston. Now, state labs can identify orthopox first, but apparently it must be sent over to Atlanta CDC for them to then confirm that it is in fact monkeypox. Does anyone else think it's kind of weird that, it can only, out of all the states and cities that we have, it can only be identified at the CDC in Atlanta? I don't know. I just thought that was kind of weird. Dr. Jennifer McQuiston, a CDC official, states, "The cases identified in the US are a milder West African strain. Most people who catch the virus recover in 2 to 4 weeks without specific treatment." So far, in recent times, there are about 200 cases documented throughout Europe and North America. But I think it's very important that we should know that monkeypox essentially has been around. Now listen to this. The US had an outbreak of more than 70 cases in 2003 because people were keeping, yes, prairie dogs as pets. Wait, so does that make sense? Because it's monkeypox comes from infected prairie dogs? Make it make sense. What? Still, according to the CDC, the smallpox vaccine is 85% effective, and the US has a stockpile of 100 million doses but it has significant side effects, so spreading it worldwide would kind of be a sticky situation. Now, fortunately, there is another vaccine called Janios or something like that, and it does have significantly less side effect. Unfortunately, it is only for 18 and older. It involves taking 2 shots. You know, I'm already kind of tired of my C19 shots that I had to get, you know what I'm saying? And there's only 1,000 available. So just thinking in the foreseeable future, let's try not to fight over those, because you know, people can get kind of crazy. For now, the vaccines are distributed to those who need it most. This includes monkeypox patients, of course, healthcare workers, close personal contacts, and those at high risk. So as the CDC put out this article directly for gay and bi men, do you guys think it has to do with sexual orientation, or do you guys think it really just has to do with the location that you're in, and they just happen to be in an unfortunate location? Still, despite your sexual orientation, I think it's very good for us to all be well informed, as we definitely don't want another C19 situation, because I've been outside a little bit and I can't go back now. You know what I'm saying? I'm not about to spend another 2 years in the house. I'm trying to be outside with the people. So I hope everyone has a blessed day today, whether you're a gay man, a straight man, a bi man, a gay woman, a straight woman, a bi woman, a trans person. I don't know if I'm hitting all of them, but if you have a beating heart and are a human being on this earth, I wish you the best day, and I hope that you are blessed. So if you like this content, like, comment, subscribe, all of that good stuff. We're on the road to 1,000 subscribers, and as you guys already know, I can only get there with you guys' help. So have a blessed day, and maybe use a stop loss.